I'm Danielle, your host of the Abridged to Motherhood podcast, the place where moms like you learn to thrive, not just survive through pregnancy, birth, and postpartum. I'm a birth and postpartum doula and a mom of two who's been where you are. My first pregnancy was filled with so much excitement, but it was also marked by stress, anxiety, and fear of the unknown. I thought I had everything mapped out, but when postpartum hit, I realized how unprepared I was for the physical, emotional, and mental toll of motherhood. It was overwhelming, lonely, and nothing like I imagined. When I found out I was pregnant again, I knew I needed to approach things differently. I made it my mission to not only prepare for postpartum, but to prioritize myself in the process. That shift changed everything. Now I'm here to help you do the same. Whether you're navigating your first pregnancy, feeling buried under endless advice, or struggling to figure out what you actually need for postpartum, this podcast is your safe space. You'll find practical tips, honest conversations, and expert insights to help you feel informed, supported, and empowered through every stage of motherhood. If you're ready to feel confident, prepared, and truly supported in your motherhood journey, stick around. This is for you. Hey friends, welcome back to the Abridged to Motherhood podcast. I'm so excited. Today I have Joanna Pavlak with me. She is a pelvic health physical therapist specializing in fertility, pregnancy, and postpartum care. She's the founder of Fertility PT, a hands-on clinic rooted in evidence-based compassionate care. With specialized certification as a pelvic rehab fertility specialist and years of experience supporting individuals through every phase of their reproductive journey, she helps people feel strong, empowered, and connected to their bodies. As a mom, she knows the challenges of postpartum recovery firsthand. Her mission is to create a supportive space where patients feel truly seen and cared for, whether they're rebuilding after birth, managing pelvic symptoms, or preparing for pregnancy. Joanna, thanks so much for coming on the podcast. I'm so excited to talk about all of the things fertility, pregnancy, postpartum with you.
I'm so excited to be here, Danielle.
Let's just dive right in. I want to know a little bit more for my listeners what exactly you do and how you became so interested in the fertility side of physical therapy.
Absolutely. So I started my career as a physical therapist, kind of more in the outpatient setting that you would think of when you think of physical therapy. And then about a year in, I was working with a pelvic health physical therapist who was moving, and my boss approached me to see if that would be something I would be interested in learning to kind of take over her caseload. And I hadn't yet found my passion, so I said, why not? And so I ended up learning, taking some extra specialization courses at that time just to get into the pelvic rehab side of things. And I ended up actually finding a passion in there. And then along the way, there is a pelvic rehab conference every year in Atlanta. And I was attending 2 years ago. At the time, I was about 32 weeks pregnant with my daughter. And there was a speaker there who was bringing to light this kind of new part of pelvic rehab in terms of fertility and how physical therapy can actually help with that. And so at the time I was pregnant, obviously, so I was near and dear to my heart. I kind of put it on the back burner, and I was on my maternity leave, and she announced that she was creating a specialization program. And I said, you know what, why not? Let's do this. And then after completing the specialization program, I did the hands-on lab portion, and on my drive home from that lab, I just decided this was really what I had to do. And so I started the process of founding my business at that time.
I love that so much. I feel like so many moms that I talk to that are in this space, it's because they became a mom that they found something and they recognize how important the need is for it. And I feel like we hear a lot about pelvic floor therapy. It's become more and more popular in the last few years, especially with social media. But this fertility side of things, this was brand new to me when we met and talked through all of it. So, what are some of the biggest misconceptions that you hear about, physical therapy for treating fertility and reproductive health?
Absolutely. So There are quite a few misconceptions in terms of physical therapy, in terms of pelvic rehab, in terms of all the fertility things. So, one of the big ones is that infertility can really only be treated with IVF. Now, I absolutely work with people that are going through IVF. There's a lot that I can do to help optimize those outcomes, but there's also some strategies that we can try beforehand. I do a lot of hands on manual physical therapy, so visceral manipulation and fascia mobilization. Those are some big key terms. And then I can also do a lot of counseling in terms of helping people get the right resources for whether that's nutrition, whether that's getting them connected with the right practitioners. They could be functional medicine, they can be endocrinology, lots of other resources as well. So I've kind of really built my network out for that. Additionally, some misconceptions about pelvic rehab is that it's only for postpartum and you can only address things after the fact. So people often experience a variety of different symptoms, whether it is just loss of core strength, whether they start to have any like bowel or bladder symptoms. Some people might experience some pain with intercourse, postpartum, but all of those things can also be addressed beforehand. You can really help, prime your body for pregnancy and do a lot of prep work while you're pregnant as well. So I work a lot during pregnancy as well, helping people gain core and glute strength, helping them prep for labor and delivery, and addressing some of those common symptoms along the way.
Yes, for me, I didn't get pelvic floor therapy until after my second child. And looking back, I think to myself, oh, wow, this could have helped me so much. I know when we met in person, I was telling you about how, both my babies had torticollis and that imbalance in my pelvis could have potentially been worked on prior to getting pregnant. So I think it's so important for women to hear that. And these symptoms, you don't have to live with them forever. There are things that can be done that you don't have to leak. You don't have to have bowel issues. You might have tightness or not enough tightness, and you can feel better. And I don't even think I realized how much pain or discomfort I was in until after I got that relief.
Yeah. And one of the big things that I like to always say is that just because something's common doesn't mean that it's normal. So you don't have to live with symptoms just because a lot of people have them too.
Exactly. Let's dive a little bit more into how your physical therapy support can help someone who is trying to conceive, and especially the women that are facing the challenges, because I just find all of this so fascinating.
So, a lot of the hands on things that I do, for example, like the visceral manipulation. So, essentially, what that means is that I am using my hands to mobilize, bring some blood flow to the organs. So, it brings blood flow to ovaries, to uterus, all around bladder, and we can help improve mobility. So, a lot of times there can be scar tissue that gets built up, or just some fascia restrictions from a variety of factors. It could be endo, it could be past surgeries, it can be general bowel health or gut health. If there's been like a long history of painful periods, things like that can actually all be influenced by the hands-on work. It can also help with regulating stress and those fun hormonal feedback loops that we have. So a lot of people think of your ovaries just as a reproductive organ, but they're actually part of the endocrine system. So they have a big impact on thyroid function, which is one of the big things we hear about when we're talking about infertility. So working on the ovaries and working on all that surrounding tissue can impact that as well.
Yeah, that was something brand new to me when you shared that about the ovaries being part of the endocrine system, which is crazy to just our bodies are so connected and one system influences the other so much. And I know fertility is such a personal and emotional topic for women. And I know how hard it is because you might not want to get your hopes up if you're struggling with infertility, but at the same time, I want women to know that there are maybe some other options out there that they haven't thought of yet or heard of yet or tried yet. And maybe that can offer them some hope. And I know a lot of my listeners, they start listening to me when they're pregnant or maybe they're postpartum, but I hear so many times about secondary infertility. So can you kind of talk about secondary infertility and what this work does to help along that journey as well?
Yeah, so secondary infertility can be from a variety of different reasons. Pregnancy kind of amplifies any symptoms that are already happening in our body. And then on top of that, they could experience a variety of different traumas through their first pregnancy and their first postpartum period. For example, if they had a C-section, a lot of people think that like their pelvic floor is spared by having a C-section, but that is a whole other side of things. They still have some of the pelvic floor symptoms, and now they have an abdominal surgery as well. Core strength is impacted. There is scar tissue that can now impact some of those reproductive organs. Like I said, a variety of different things can happen in that postpartum period. Hormones kind of go out of whack. It takes a very long time to regulate those again, especially if we put in breastfeeding or extended breastfeeding. Hormone levels can continue to fluctuate for a lot longer than people realize. Ways that I can help with that. So again, a lot of the hands-on skills are really good for scar tissue management to help decrease inflammation. If there was a pelvic imbalance that happened from how you carried, from how you delivered, we can work on kind of improving that alignment, improving strength. And also sometimes after a pregnancy, people can have really a disconnect from the pelvic region of their body. They don't want to think about it. Things have changed, things are different. We work on kind of overcoming that barrier as well. There can be breathing techniques, there can be strengthening techniques, there can be the hands-on skills again.
And then as we move into pregnancy, I know you talked a little bit earlier about how PT can help you prepare for labor and delivery too. So how do things shift once we're into pregnancy and working with a physical therapist?
When we shift from that pre-pregnancy into pregnancy time, a lot of the focus shifts to supporting your body as it grows and changes, trying to reduce strain, help prepare for birth. So we still want to emphasize core and pelvic balance, alignment, blood flow, all those things, but we can also try to prevent some common issues from occurring at all. So SI joint pain, back pain, urinary or fecal incontinence. A lot of people experience like pubic symphysis pain, or trying to encourage diastasis recti to kind of stave off a little bit. So 90% of women will experience some level of diastasis by their 9th month, but we can encourage some increased core strength so that that is less likely to happen, or is at least a lot easier to recover from. But yeah, so we do a lot of movement-based support, breath work, and more gentle manual therapy.
And how wonderful to be able to do things so that you're not experiencing some of those common pregnancy
Mhm.
symptoms that so many people face. And what I think is so wonderful, and we talked about this before, is that a lot of times people think, or there's a misconception, I guess, that physical therapy and chiropractic care shouldn't be done together, or that if you have one, you don't need the other. But we talked about this, like how both can help you in your pregnancy and your postpartum journey too. And it's just like another piece of the puzzle that we can add in to help support our bodies.
I would say some of my favorite people to work with are also seeing chiropractors, and a lot of my best referral sources, kind of back and forth, are chiropractors. I like to approach it as, the more eyes you have on something, the better the outcomes are going to be. I love having a multidisciplinary approach, having, a whole team to help work on anything that someone might be experiencing.
I've been there where you're pregnant and maybe maybe it's a second or a third pregnancy, so you have multiple children and you're thinking, I don't have time to go to another appointment, or I don't have the means or the funds to do another thing. And I get that and I hear that and I have been there. But when I have taken that time to either make sure that my children can come with me or find someone to watch them for an hour so that I can take care of my body, I have the energy I need. My emotions are better in check. I'm regulated all over because I'm taking that time to care for myself and my body. And what better way to do that than start during pregnancy too, and not wait until postpartum.
Yeah, it's always easier to kind of come from a preventative approach rather than trying to play catch up after the fact. Also, on the same topic, you were talking about childcare. That's one of the cool things about my space is that there is actually on-site childcare, and also always welcome to bring kids along for any type of appointment.
The best practitioners are that way because they get it and they know if you're serving moms that you're going to have to be willing to have littles running around in your
Of
space or
course.
having toys available, whatever.
I've had 3 kids in the room while I was working with a new mom before, and you know what? We made it work. And
Yep.
sometimes that's way more functional because that's what life is. You're not in an isolated environment all the time. You have to just kind of roll with it.
Exactly. I love that. I love that so much. Okay, so we talked about fertility, we talked about pregnancy. Now let's get into postpartum and what that looks like in working with PT moving forward.
This is the more common that we hear of with pelvic PT is the postpartum period. Postpartum, we are doing more an individualized approach of, what do we want to try to get back to doing? What did you experience? What changes happened to your body during pregnancy, during labor delivery, and working on treating those things. So, whether that is trying to access pelvic floor strength again, trying to get the muscles to coordinate together, we have what's called our deep core. So, those 4 muscle groups are our diaphragm, our abdominal muscles, our back muscles, and our pelvic floor. All 4 of those work together like a canister or a piston. So when one member of that team isn't working how we want it to, the other ones kind of come in and compensate. So we're working on treating all 4 of those muscle groups to get them working together again, getting them, supporting the muscle groups that may have gone through the most changes during pregnancy. All 4 of those muscle groups do change drastically during pregnancy. They all take on different roles, but we want to address all of them to help get moms strong again. So it can be, again, some of the things like treating that diastasis or treating any incontinence or any scar tissues, whether that is from a C-section or perineal tearing or stitches, episiotomies, all of those things that come along with birth. And then working on supporting emotional regulation and emotional reconnection with the body. And so we want to focus on gradual reloading, core strengthening, and just returning to movement. It can happen before that kind of 6-week checkup. You don't have to wait until, you get that clearance from an OB to start or a midwife to start coming to physical therapy. If you notice that you have some dysfunction, if you have pain, if you have some other symptoms, there are some things that we can start before that first checkup with your provider.
Yes, a preventative again,
Yes.
right? We're not waiting to get ourselves the help that we need. So let's talk to the mama who's never been to physical therapy or talk to someone about their pelvic floor and women's health PT before. What can she expect in a first visit when she's walking in? Because I know for me, sometimes that's, you have a little bit of anxiety, you don't know what to expect. So let's prepare her.
Of course. So, I can only talk to what you'd expect coming to see me. I can't speak to every, pelvic PT out there, but I always start with a good background. I like to get to know my patients. We talk about their experiences, their symptoms, their goals, what they would like to achieve by coming to physical therapy. And then from there, I will usually do a kind of a general movement screen. So all those aspects of that deep core that I talked about, I check to see how all of those are moving. So I will check hip alignment, how their back is moving, how they are breathing. I'll assess that movement. And I will also typically start with an external, like palpation of pelvic floor muscles. I don't like to do anything internal on a first visit. That can be something that's part of a plan of care. And usually, if that is part of the plan of care, what that would look like is a single gloved lubricated finger assessing the different layers of pelvic floor muscles vaginally, but I don't like to do that in a first visit. I very much like to get the comfort level. There's so much that we can learn from an external perspective. And also, sometimes that's the most intimidating part. I like everybody to feel comfortable. I also very much treat from a trauma-informed care model, and everything is done with consent, with explanation. Nothing is ever going to be done that you're not aware of the why behind it. Kind of backtracking a little bit, I do all the movement assessment. I assess breathing, back movement, abdominal strength, the external pelvic floor motion, and coordination. And then I try to get hands-on treatment day one. So whether that's just, I do a lot of belly work, so a lot of hands-on like fascia mobilization, soft, gentle stuff that first visit just to get you feeling a little bit better. If there's some scar tissue, we try to treat that as soon as possible, just kind of working into that gently. And then I usually give a couple of exercises to take home on the first visit. So there's something that you can do at home as well. Usually in my treatments, I don't like to do more than about 5 minutes of exercises while you're with me. Exercises are something that you can do on your own at home, whereas the hands-on stuff, you need someone else to do that for you. So I try to optimize the time so that you feel like you are getting your time well spent.
That was very similar to my experience with pelvic floor therapy as well, with the setting the goals and the assessing and then getting that hands-on therapy. And I never had any internal work, but I'm really glad that you addressed that as well, because it can be part of plan of care. And I think sometimes people think if I'm getting pelvic floor therapy that it's going to be internal work. That's another misconception, but you may have it and you may not. And I love what you said about the trauma-informed care and being aware of all of that, because everyone's going to have a different comfort level with that too.
Absolutely. So if it's part of the plan of care, then absolutely that can be the direction we go. But this is part of why everyone has an individualized plan of care. Everyone is different what they're coming for, the symptoms that they're experiencing. So everyone's going to be treated as an individual. There's no one size fits all approach.
Kind of to wrap up, I'd love to hear what you would say to a mom who's feeling very disconnected from her body, whether that's pregnancy or postpartum. And what advice would you give her just as a mom and as a physical therapist? And what would you tell her if she's struggling?
So, first and foremost, you're not broken. Your body is communicating to you, and that your pelvic health can be very central to your whole body wellness. You deserve individualized care, someone that listens, educates, helps you to heal. You are in control of your healing, no matter your stage of motherhood, and that there are answers. There are answers to the things that you're experiencing, and you're not alone with them.
We can feel so alone in what we're experiencing in our body, and especially with infertility too. And so the fact that we can find answers, it might take some work, it might take some time, but there are so many compassionate providers out there, and Joanna is one of those providers for you. You are local-ish to me in the Cleveland area. So tell us where people can find you locally. And then if they're not in this area, how can they find a provider who does similar work to what you do?
My practice should hopefully be opening this upcoming month. Hopefully by the time this podcast comes out, it's already up and running. But I am located in Altitude Social House. It's in Fair Lawn. It's the same building as Rogue Awakening Yoga Studio. It's a really cool space. Lots of other wellness-centric resources there as well. And if you are not local to the Akron, Fair Lawn, Cleveland area, so I did my training through, it's called Triggered Academy. They are based out of Texas, I believe Dallas. It is not quite up and running yet, but they are in the process of putting together a directory of all of the providers that went through the same specialized training as I did. It is a very new program. I just completed it this past year. Like I said, I was pregnant with my daughter when I heard about it for the first time, and she is 20 months. So it has not been that long since they created this program, but they are putting together a directory of the providers that went through this. I know there's actually a few others in the state that went through the same one as me. So I have a few names that I would be happy to share. My email is joanna@fertilitypt.com. So if anyone has questions about names before the directory is up and running, I can try to be a resource in that interim.
And where can they follow you on Instagram or Facebook?
Yeah, so my Instagram is Fertility PT. So that is fertility.pt. And I will be putting all of my updates as they come out onto my Instagram. And I also have a website as well, which is just fertilitypt.com.
Thank you so much. I will put all of that info in the show notes. So if anybody wants to connect further with you, they'll be able to find you. And I just really appreciate your time. And it's just so interesting to hear all of this information about fertility and pregnancy and postpartum and how physical therapy can just help our bodies so much throughout our motherhood journey. So thank you again.
You are so welcome. It was my pleasure. And I'm so glad I got to be part of the podcast today.
Thanks so much for tuning in to the Abridged to Motherhood podcast. I'm so glad you were here today. If you loved this episode, I'd be so grateful if you could leave a review for the podcast on whatever platform you're listening on, share it with a friend, or snap a screenshot and tag me on social media. If you decide to leave me a review, go to abridgedomotherhood.com/review. That link is also in the show notes so that I can send you a little gift in the mail. Your support helps other moms to find the podcast, and it truly means the world to me. Remember, your motherhood journey deserves your care and attention. Until next time, keep showing up for yourself, mama, and don't worry, I'm here to help every step of the way. See you soon.